for the general surgeon, what we concentrate on is mostly intra-abdominal, and we can go in the chest too. But if you think of, there's the gallbladder surgery, anything that's laparoscopic you can go with typically with robotics. And so the gallbladder is an inguinal hernia. Inguinal hernia is one of the most common surgeries in the nation. There's ventral hernias, meaning hernias of the anterior abdominal wall. Incisional hernias are hernias that occur after surgery that didn't heal well and the abdomen separates. They can all be typically repaired. There are tumors of the adrenal gland. Spleens can be removed. Some people need a spleen removed for different reasons. Reflux surgery, hiatal hernia repair of the diaphragm can be fixed. And so these are all surgeries that used to be done open, then they transitioned to laparoscopic, typically can be done, and now we can do them with a robot. In colon surgery, there's also a big advantage, I think, because again, you can remove the different segments, or if not even the whole colon, for different diseases, and do a lot of the anastomosis and hookups for colon internally instead of making a big incision. And you can take out a specimen typically to an incision that's 3 to 4 fingers in size instead of 8 to 12 inches in size. And again, what that translates in, people typically go home sooner, so the hospital stay is shorter, and many of them drive to their post-operative visit instead of someone bringing them in and them kind of shuffling down the hall. They just seem to kind of walk right in. They feel great. So again, minimally invasive surgery goals: hurt less, feel better sooner is what we're after, and again, similar results. So we can reproduce that. Now, robotics has really been proven significantly to be great for prostatic surgery, and almost all prostate surgery now for prostatic cancer is like 90-some% are removed with the robot. It is much better than the traditional open surgery in those cases. GYN surgery has been shown to be very valuable for that, for the uterus, tubes, and ovary conditions, whether it's benign or cancer. It can also be used in the chest. You can do coronary artery surgery. You can take out cardiac tumors, and you can do lung surgery, take out a lung cancer, and I've also taken out a tumor of the inside the chest, under the sternum, the parathyroid. You can there are in FDA hasn't approved it in the United States, but people around the world are also doing robotic surgery of the thyroid and parathyroid in the neck. So there are things that are done around the world that are kind of even more incredible than the United States. And when you go to the robotic conferences, it's amazing to see what's going on around the world. And they can blend an image of an MRI or CAT scan of a tumor of your chest that's really tiny, that has been found incidentally, and you can go in robotically and take out a very small portion of the lung instead of a bigger portion, which we typically would have done in the old days. And you can see in your image in the robot the x-ray image and where you're operating simultaneously, so it guides you to the spot. So there's pretty incredible things going on with robotic surgery that are really advancing the cause, again, of minimally invasive surgery.